Research conducted by Makerere University School of Psychology has confirmed that over 80% of Ugandans suffered psychosocial stress during COVID-19-induced lockdown.
But what we found out is that most, maybe 80% of the families were affected. You know, this is a mass, it is a mass problem. Where majority of it is a community problem, where the majority of the families are affected.
While unveiling the report to the general public, Professor Peter Baguma noted that psychosocial stress is a public concern that ought to be addressed.
People experiencing psychosocial problems like stress, like people with depression, with anxiety, with worries.
Makerere University under School of Psychology conducted research on mitigating the problem, and findings from the research confirmed that the family resilience and coping intervention proved effective in reducing family psychosocial stress among families that received counseling compared to those that did not.
One group was cancelled. We call that one the experimental group. Another group was not cancelled. This is called the control group. So after 3 months, we looked at these groups and we measured their psychosocial problems. We measured their psychosocial problems at the beginning, before we started giving them counseling, and also after 3 months of counseling, we came back and asked them about their psychosocial problems.
Nsobia Henry, a parent and a health worker at Mulago Hospital, attests that counseling helped him recover from psychosocial stress and discrimination after he suffered from COVID-19.
We were still battling with the after effects of COVID-19. Even me now, I'm still battling with them. When we fell sick, we were isolated. Again, after the sickness, we were discharged, still we were isolated. Our relatives could not visit us. The neighbors could not visit us. So when we received this team, they gave us hope. They talked to us a lot.
But because of the advice and counseling of these people, they counseled me. They tried to make me know that if you have lost someone, you should not lose hope. The life has to continue.
It is upon this background that Professor Baguma called upon the Ministry of Health to adopt this method as a tool to help families affected by stress of pandemics.
Look at policy of how do we help families that are in need of psychological help. It needs to come out and then give support. It should be written in their papers that, for example, this type of counseling has been proved to be useful, and then it should be expanded.
Saddam Ubale, UBC News, Kampala.